I'm speaking with Dr. Pedram Gerami of Northwestern University, an expert on molecular testing in melanoma and suspicious lesions. When should office-based dermatologists be turning to these newer tests?
Okay. Well, we have molecular tests for various components of diagnosis and prognosis of melanoma. The most popular ones that are being utilized now are in the scenario when a lesion is biopsied and the histopathologist feels that the diagnosis is ambiguous by standard pathology methods. I think the first thing to do in that scenario is to speak with your dermatologist and try to do some clinical correlation. If after that you still feel like you've kind of hit a dead end and there's ambiguity to the final diagnosis, I think those cases are the ones that one would select for molecular testing, where a more definitive answer can't come from just the histologic and clinical or dermoscopic correlation.
So what percentage out of, say, 100 suspicious lesions, what percentage can't be resolved in your mind by the histologic and dermoscopic findings?
There's a lot of studies addressing that question, and I would say depends on the practice setting. If it's an academic setting with a lot of difficult cases, it could vary anywhere up to about 5% to 10% of cases. In a more private practice setting with more routine histopathology, probably closer to like 1% or so. So I think a nice spectrum would be somewhere between 1 and 5% of cases.
And what's the best molecular test to choose? What's validated?
Yeah, so there's a number of different types of assays, ones that are based on looking at copy number changes of important tumor suppressor or oncogenes, and those methodologies usually are FISH or CGH. And then there's also quantitative PCR methods that look at the expression levels of certain mRNAs. Both tests have different strengths. I think as far as validating in the type of cases that you'd really use the test for most appropriately, those histologically ambiguous cases, a validation study that shows a correlation with the molecular findings and long-term follow-up, I think FISH is the one that's most validated in that scenario. There's a lot of studies that have been done with some of the newer quantitative PCR studies, but they haven't addressed the histologic cases that are truly ambiguous where it'd be most appropriate yet.
Okay. So for now, FISH is the way to go.
I believe so.
Okay.